today I'm talking about recruitment and retention in rural areas. You may have seen this headline on the news stuff, NZ Doctor recently, small town GP offers 400,000 for a job and no takers. That's reasonably, not the salary isn't, but it's reasonably typical of most places in New Zealand for healthcare professionals. It's very difficult. Most GP practices in rural areas would have jobs, vacancies at the moment, and the concerns around that is the isolation that people face. This is a report dated back to 2001. It had 20 recommendations of the issues of isolation in rural and the result on the workforce in New Zealand and the shortage of. Interesting, it was 2001 and probably every single one of those items are still open. Let's go back in time to the Hokitika Guardian in 1865. The issue in recruiting doctors back then was around the concerns of isolation. It was the same in the goldfields of Otago around a little bit earlier as well. So nothing's changed in all this time. Everyone's assuming that technology is going to be the golden bullet and it's going to take away all the concerns that people have, but the reality is it hasn't. We all keep on talking about it, but who's actually using it at the moment? And Murray's talked about the networks and how things are progressing. Kyle's talking about the early stages of things. So how are we going to get people using this? An interesting point, someone spoke before that 7 out of 10 people in rural areas were over the age of 55. In our surveys, we've found that most rural nurses are 55, in fact they're 57 now because it's 2 years later since the survey, and 85% of them are part-time. Connectivity has been an issue up until now in rural areas. This isn't a picture of New Zealand, but it's around the issues, and we've had some major issues over the years with connectivity. It's getting an awful lot better than what it was, and it's been pretty dramatic. Over the years, we've used microwave dishes off Cordia and beam into rural valleys, into hospitals to get connectivity in the early days. We were paying the same rates as television stations back then for each of the towers. It was very expensive, but connectivity is getting a lot better. Anyone recognise who this is? Well, it is Obama, but the quality of the network is particularly good, particularly in health. If you're expecting someone to use a network, you're expecting good quality. If you're Skyping the grandkids on Christmas Day and they're running around and it's pixelated, that's good for a few minutes. But if you're using good quality connections for diagnosing things or sitting in front of things, learning things all day, you need a decent connection. I'm about to talk now about education in rural areas. So Mobile Health delivers an individualised, tailored program to a number of rural towns around New Zealand, providing medical education tailored to those rural towns, because the issue for isolation in those towns is around the concerns I spoke about before about people won't move to rural towns because of the isolation. So therefore, if we could provide good quality education in a town that's relevant to them, Joe doesn't have to drive to Tauranga for a half-hour session on managing diabetes in Tauranga. He wants to know about Apotiki and delivering healthcare in there, and about diabetes with his nurses and the paramedics, etc., all in the same town. So how do you get that? Video is obviously the way to go, but how do you actually do it? So recreating a seminar where it's a virtual guest with good quality is very important. This is our studio in Christchurch. We use a number of networks to connect to a number of rural towns around New Zealand. We use Connected Health. We use Andy with Wireless Nation with their satellite. Vivid Networks, Zoom, video. So the connectivity is very important. It's very difficult to get into each of the towns. It's a bit like holding hands and singing Kumbaya with some of the network providers, because some of them aren't as interested in dealing with each other. But in the end, we get there. So here in our studio in Christchurch, we've also got a studio in Dunedin and in Auckland, soon to have one in Hamilton and Whangarei as well. So here we are connecting Dunstan Hospital with our studio in Christchurch. Now, the seminars that we provide are particularly focused on that town, so they decide the content of the video. Having two screens is very important so that you can see the presenter, you can see the facial expression, and the person at the other end sees them, so it's live interaction. So here the presenter can see Mary at the front, you can read the name badge. Mary, you didn't understand what I said. Can you tell me why? What is it about your town? How can we get around that? And it has to be very engaging, so the quality of the bandwidth or the delivery of the picture is very important. We show a variety of topics, and this is an echocardiography live. We're up to about 42 towns around New Zealand where we provide this network, so it's individualised point to point around town. It's not a broadcast where you're watching television. It's not recorded. The important things about this is it's their show. Local coordinator in the town, there's a lot of interaction, so the town decides the topics. It's time to suit. It might be 2 hours in the afternoon or an evening session for GPs. We have 70 presenters around New Zealand that present into this network. The majority of them are clinicians, but sometimes it's social welfare, it's privacy officers, it's a variety of things. The types of, this is one going back a ways, but here we are, beating the blues, dietary management of diarrhoea and constipation, a riveting topic as you can imagine, pain and urinary tract infection, so it's very tailored to the town. Some of the other things that we're doing at the moment as well is using video for practical procedures. Here we've got a GP actually on the surgical bus practicing an echocardiogram and getting feedback from the cardiologist at the other end, so it's another form of teaching. So all these things are leading to helping with recruitment and retention of the town, because imagine if we could attract more people to those towns because of the connectivity that we had into those areas. So rather than the issues that we had at the moment of recruitment and retention, we could actually have a whole lot of people heading to the rural areas because of the connectivity. The engagement is really important. It's no point in someone sitting in there for 3 or 4 hours with a poor quality pixelation. It has to be about their town, so having the doctor and the nurse in the room talking about the services in that area is a particularly important. Bandwidth is essential. I know Kyle's spoken about the lower bandwidth that they're working on. Our experience is probably slightly different. If you're spending a few hours in front of a screen, it's particularly good to have that quality of connection. And also some of the things like lighting. And I think we're going to have a bit of a test in a minute with John Garrett. I mean, any of you folks that have been to a conference before where you do a live video link and the connection isn't great or there's poor quality sound, it can be hard work, and I suppose the next session is going to be a bit of a test. So does better connectivity improve recruitment and retention? We believe so, but the test is yet to come. Thank you.